Here with Dr. Crystal Champion, a breast cancer survivor, thriver, and a lymphatic specialist. She's going to give us 3 tips for lymphedema.
So for lymphedema, the first thing is to look for any abnormal swelling, heaviness, tightness after surgery or even years after treatment. Tip number 2 is if you're noticing anything abnormal, please ask your medical team for a referral to a lymphedema specialist. Number 3, I know there's a lot of information out there about compression garments and what you should wear, what you shouldn't wear. But again, make sure you see a certified lymphedema therapist. You can see a certified mastectomy fitter to get the correct compression bras. And again, just making sure everything is fit for you so that you have the most success possible in the journey.
I'm talking about things as simple as opening and closing the hands, bending and straightening the elbow, raising and lowering the arm. Deep breathing is also a very important exercise that anybody can do at any time of day because deep breathing stimulates one of those vein vessels that pumps and circulates lymphatic fluid through the body. So it's things as simple as deep breathing can help kickstart your lymphatic system and get things to where it moves. And I have a little disclaimer down here. I don't know everybody's medical history, but I will say exercises that are specific to you, the treatments that you have had done, that guidance should be given from a certified lymphedema therapist or physical therapist if you're not sure where to start, okay? So in order to measure progress with lymphedema treatment, we do take limb volume or arm measurement. So we take a little tape measure. There's other tools that are developing now to measure how much lymphatic fluid you have accumulated in the area. But basic standard is just taking a marker, doing certain points on the arm, taking a tape measure, measuring what that looks like before treatment starts, and then as you start to have your swelling decrease, we take measurements periodically throughout the treatment to monitor when you hit that plateau, when I push all the fluid I possibly can out of you, and then we move into the maintenance phase of treatment. So then this is an example of a patient I had that stage 4 breast cancer, chemotherapy. She was not a surgical candidate, so she actually still had a tumor that was pressing on her lymphatic system and causing her right arm to swell. So I don't know how well you can see that. I don't know if my little laser's not showing up here. But her right arm is swollen. I did some compression bandaging on her for a certain period of time. And then after treatment, this picture right here, you can hardly tell the difference between the right arm and left arm, right? And then for maintenance, she was put into compression garments. And I'm so glad that it was made a skin tone that looks fairly close to hers. I was happy about that. You know, like the basic beiges and the nudes, and they don't always match up. But I digress. So now we'll move into a little bit about lymphedema risk reduction. So as I mentioned early, skin and nail care is very important. When you're at risk for lymphedema, anything that can cause damage to you or trigger an infection can onset lymphedema. So, you know, going to the nail salons and having your cuticles cut. I'm not saying don't do it, but this is just some things to be mindful of. You know, keeping your skin clean, moisturized, keep it from cracking. You know, if you have any bug bites, skin burns, anything of that nature, you want to make sure you're paying attention to them and getting treatment so that it doesn't turn into an infection. And again, just making sure you're really meticulous about your skincare. And again, if you already have lymphedema, then again, this can trigger those symptoms to reoccur, you have a flare-up, or it can start to progress. Temperature changes, so extreme heats like hot tubs, saunas. There's research saying that, you know, try to limit exposure to 10 to 15 minutes to this because heat causes dilation of your blood vessels, and when you have a compromised lymphatic system, fluid rushes in and then it can't be pumped out appropriately, so that's why there is some caution around extreme temperature changes. And also from extreme cold, it's just extreme temperature changes. Your body's already been through enough, and so those things can stress a lymphatic system that is already at risk, and it can potentially lead to some issues. Limb constriction, so avoiding tight clothing, tight bras, tight jewelry, tight shirts, jackets, squeezing on the arm, being careful with carrying heavy bags on a side that is at risk for lymphedema, or if you have lymphedema on that side. Trying to wear lightweight breast prostheses. Again, avoiding tight elastic bands. So those are some things that can help reduce constriction that could trigger or worsen swelling. And then nutrition. I get this question all the time. There's really no special diet for lymphedema, but as I said before, obesity is a risk factor. So just trying to maintain a healthy weight as much as you can. I know Dr. Mo in her session just talked about, we're on all these medications and we're expected to maintain a healthy weight, but you're on these hormone blockers that are making you gain weight. We're perimenopause, postmenopausal, going through menopause. So we do have some things that are working against us in that regard. But just trying to eat a lot of fruits and vegetables, things that are anti-inflammatory, staying hydrated, drinking a lot of water does not cause swelling to increase. Actually, if you're dehydrated, your body will tend to hold on to fluid, and that will actually make you swell. So do not stay away from drinking a lot of water. Hydration is very important to help flush your body when you're dealing with lymphedema. And then, of course, limiting alcohol consumption, smoking, all those things can be inflammatory to the body that could cause a flare-up of symptoms. Exercise and lymphedema, I know I already touched on this, but again, the key is if you don't know what to do for your particular medical history, body type, limitations that are going on with you, please get a referral to a physical therapist who can give you the guidance that you need specifically for your condition. There are a lot of cancer centers, physical therapy centers that have therapists who are certified in breast cancer rehabilitation or oncology rehab in general. So it's important that you advocate for yourself, because you don't always get the information. Advocate for yourself to get a referral to a lymphedema specialist to give you some guidance. That is your right to be able to do that. So again, exercising low and slow, easing into things. You may have been able to do a 5K before. I don't recommend you trying to do that right out of the gate. You may need some guidance just so you don't injure yourself and cause things to get worse. And then, of course, if you do have lymphedema, I've seen a few people walking around with arm sleeves. Doing exercise with your compression on actually helps to move that fluid. So exercise and compression are all good things. Medical precautions. So this is kind of evolving, so I kind of say this with caution. Typically, we're told to avoid blood draws, IV sticks, blood pressures on the side of lymphedema. But there's now research that says if you're in that stage 0, if you're at risk, you don't really have to be as mindful of this. But if you do have lymphedema and you've been diagnosed with this, this is more of a hard absolute, like these are things you need to be following. But again, research and data is evolving. I tend to be conservative. I'm like, do not take my blood pressure on my left arm. If you need to do it to save my life or draw blood, that's fine. But if I'm alert, conscious, awake, and I can make that decision, do not touch my left arm. And make sure you say that to your medical team because they will not always ask you, right? Okay. So again, I'm conservative. Again, you can ask your medical team, you may get different answers, but like I said, I lean more conservative. I'd rather protect my arm than not protect it. Air travel. How many people flew into Vatican? Yeah. So, about that.
Tell them, Doc. Tell them. This is my favorite one.
Moving around, activity on long flights is very important. Even if you can't stand up and walk around, like I said, just a gentle movement of the arm just to keep that circulation moving. Travel with antibiotics if you have lymphedema and you're prone to risk of infections. You want to have something with you in case you're walking Stone Mountain and you get a bug bite. Again, if you do have lymphedema, you want to make sure on air travel you're wearing compression garments if you have them, because the decreased air pressure on the flight will cause your tissues to expand and it will actually cause you to swell. So it's recommended that you wear your compression sleeves, gloves on the airplane, and then 2 to 3 hours later to accommodate for any pressure changes depending on where you are. If you're stage 0, you're at that risk. Again, it's kind of like if you have it, do it. But if you definitely have swelling, or if you're at high risk, like you've had all your lymph nodes removed out of your armpit, you've had radiation, but you don't yet have swelling, I highly recommend that you get compression. And we'll talk a little bit more about compression as I go along. Here we go, compression garments. So there's different types of compression for different parts of the body. So these are examples of daytime compression garments and nighttime compression garments. So daytime garments, what I'm talking about is your compression sleeves, your gloves, your gauntlets. Sometimes there are people who can't tolerate compression sleeves and gloves, so there's Velcro adjustable options that can work during the daytime. At nighttime, you can also do a Velcro wrap option, but there's what we call foam-filled chip sleeves. They're especially designed to be worn at night. And another question I get is, well, can I wear my daytime sleeve during the night when I sleep? It's just so much easier. The answer is no. Because daytime sleeves are specifically designed to control swelling when you're up and active during the day. If you're laying down at night with that sleeve on, it's gonna feel tight, it's gonna constrict, it can roll, it can act as a tourniquet, and it can actually make swelling worse or induce swelling. So daytime garments are not designed for nighttime, okay? There are garments specifically for nighttime if you need that. Not everybody needs nighttime compression, but that's why it's so important to get an evaluation by a lymphedema therapist, and they can tell you what you need specific to your condition. So I talked about trunk, torso, swelling in the breast, underarm, back area. So there's compression shirts, tank tops, there's different styles, again, depending on if you have flat closure, things that'll go flat to your chest. Some of these have pockets that can do breast forms and shapers and things of that nature. And then compression bras. Again, I work for ABC, so I'm gonna plug that we have the best compression bras in the world, and we really do. Again, compression bras can be used for daytime and or nighttime. They can be used through all phases of, whether you're right out of breast surgery, on into lymphedema treatment. All of them have pockets to support breast prosthesis, breast forms, breast shapers, and you can also layer them with a pressure pad of your choice. I'm going to talk about pressure pads here in just a second. And importantly, it needs to be breathable so you can maintain skin hygiene. Sweating and all that oil skin buildup can lead to infection, which we know is a no-no to prevent lymphedema from worsening, right? So again, when I talk about swell pads or pressure pads, so if you have an area that's really, really hard to get to, I'm wearing a compression bra and it's not really doing the job, I feel like I need a little bit more, your therapist can recommend a pressure pad to insert in that bra to specifically target the area that you're having issues with. And they're designed to fit different shapes. So chest wall, it can cover the breast, specifically just to the front, it can wrap around from the underarm and go to the back. So there's different styles. A lot of them are foam filled. There are some now that are now silicone pressure pads that are available on the market. I was at ABC, we now have a groundbreaking silicone pressure pad that you can wear with your bra and directly against the skin to help with those symptoms. Compression pumps. Anybody familiar with a compression pump? So there are compression pumps on the market that can help with lymphedema. I'm a huge advocate for compression pumps, especially if there's areas where it's hard to get to a lymphedema therapist and they say, hey, you need to come in and see me 3 times a week, and you're like, well, I live an hour away, how do you expect me to do that? So pressure pumps can be an adjunct or supplemental treatment for you to be able to treat yourself at home when you cannot get to a lymphedema therapist. And again, a prescription for something like this usually comes from the doctor, or again, if you're in lymphedema therapy, your therapist can recommend this for you. And companies have trainers that will come out and teach you how to use this. So pumps can be very, very beneficial. But even though pumps are available, you will still need some form of compression to maintain that reduction in swelling that you get from the pump. So the pump mimics what I do as a therapist with that nasal lymphatic drainage I talked about earlier. The pump kind of does that in my absence, but again, wearing compression is going to be key in long-term management and prevention for lymphedema. So massaging breast forms and prosthesis, again, ABC is the plug. There are breast forms and prosthesis that are designed specifically to help with lymphedema treatment. So there are some that are patented with massage technology built into it that you can wear directly against the chest, or you can put in that pocketed bra, compression bras that I talked about. And again, a lot of women don't know that. Did y'all know breast prostheses are covered by insurance? Yep. Okay, good. Not everybody knows that. And it can, and a pump, but it's plan specific, I will say that. And bras, exactly. So I'm glad you all were saying that, because because there are a lot of people, a lot of patients I've had, they're like, well, I've been ordering bras from Walmart and Amazon, and I've tried this, that, and the other, and it's not working. It's like, do you know your insurance can cover this? By the time you spend $200 ordering different things that don't work, you could have had your insurance pay and cover for these things. And I also say, again, with compression, when we're talking about breast prosthesis, you need to go to a certified mastectomy fitter or compression garment fitter to make sure you have the right fit. Just because things are available online doesn't mean you should get them online. You really need someone who's trained to give you your right size, make sure it's the right fit, again, because if you don't have the right tools, it can create a problem, and you don't want that. So certified mastectomy fitters are your best friend, and is also the best friend of the therapist, that we can use those providers in the community to help you all. And again, breast form shapers, there's silicone, again, that massage back technology. Again, this is something from American Breast Care. So again, just something to put directly against the breast, lay flat against the chest wall that can help manage symptoms of lymphedema. This is actually considered a partial breast prosthesis, so again, this is something that can be covered by insurance, okay? So the Lymphedema Treatment Act, there is legislation that came out in January of 2024, so not that long ago, that mandates the coverage of lymphedema supplies. So compression, garments, bandages, daytime garments, nighttime garments. Specifically, this is mandating Medicare to cover these things. Most private insurance plans kind of follow what Medicare does, but again, a mastectomy fitter or whoever you're going to for your garments can check your insurance and verify what your coverage is. But again, it's so important to know that you have access to this, and as breast cancer survivors, certain things are mandated to be covered. So make sure you use that. And even if somebody tells you, oh, it's not covered, like, well, can you check, please? Okay. And then lymphedema support resources. Again, American Breast Care is exhibiting in the resource hall. So make sure you stop by, because there's resources on the table for lymphedema. So all those symptoms, risk reduction guidelines I talked about, there's a brochure you can get for that. We now have a lymphedema symptom screener called Tune Into Your Body. So it's like a little postcard. And if you have symptoms, if you're checking any of those symptoms, that says, you know what, I need to ask my doctor or somebody on my medical team to give me a referral to a lymphedema specialist. So this is something you can use, or grab something for someone you know who may need this. And then also there's another treatment guide that talks about the compression bras, regular mastectomy bras, breast prosthesis, and all of the things that is needed to treat the whole woman from start of care all the way into whatever she needs into survivorship and thrivership. Okay. To find a certified lymphedema therapist, these are some organizations that have directories that you can find therapists local to your area. So you have LANA, or the Lymphology Association of North America. You have the National Lymphedema Network, and then you have the Lymphatic Education and Research Network. I'm not sure if these slides will be sent out to you all. I'll find that out, but it's important that you go to somebody who's certified. If you don't take anything else from this presentation, if you're gonna see a lymphedema therapist, they need to have the initial CLT behind their name, okay? Lymphatic massage and drainage is becoming really popular in the plastic surgery world, so you've got everybody out here willy-nilly trying to do lymphatic treatment and saying that they know what they're doing. That's not true. So you wanna make sure you look for those initials that say CLT, okay? The big picture, I love Snoopy, he's my emotional support, I absolutely love him. But the big picture is knowing what the signs are and knowing how to recognize them early helps to improve outcomes, prevent worsening, and helps to preserve your quality of life. So, it's not fun to think that you could possibly get lymphedema, or if you have it, oh gosh, every day I have to do something to manage this. But it's better to know what to do and how to treat it so you can keep it under control. So early intervention is super important. Any questions? Yes.
You were talking about when you fly, you need to wear the compression garments and that kind of stuff and try to move your legs and everything.
Yes.
You can get your doctor to write that you have to get up and move every 2 hours. I found that helpful when you're flying international, because they look at you kind of when you're up and about. But if you have that and you're over your position, they don't have a problem.
That is good to know. Did everybody hear that?
Yes.
That the doctor can write an order for you to move around on the plane so they don't give you the side eye? You're up. Okay.
Before we
So again, it's something that's a preventative. If you actively have leg swelling, again, you may need to see a certified fitter to fit you appropriately for compression stockings, because again, if things are not fitted well, it can cause an issue. But to wear compression garments as a preventative, that's something you can always do. Again, I just stress, make sure it's fitted to you, okay? Back here in the back.
Hi, I just wanted to, mention that, so last year in August, I started having a lot of swelling, and, thought something was really going on, because it was mostly across here and under the arm, and this part of the arm here. And so, I was first diagnosed in 2016, had no problems, did tamoxifen, had a reoccurrence in 2023, had 33 rounds of radiation. The following year, 2025 is when I started experiencing a lot of swelling and issues, So I went to the oncologist and I told her about it. But the problem that I had with all of it is, I went through the radiation, I was currently constantly seeing my oncologist. She never mentioned, hey, be on the lookout for this might happen. Didn't say anything to me until I went in with the problem and started telling her, oh yeah, like as a matter of fact, but you never said anything. I have a problem with that because I feel like we're not properly informed about a lot of stuff. It's just, you find out because you found out because it's happening too. I wish it would be more, more informative from the beginning. And, so getting used to wearing the sleeve, I don't like it. Sometimes I forget about it. My coworkers help me remember, where you see that, girl? So, but, and I didn't get a stage. I think I might be stage 1. And I don't see a lymphedema specialist. I have an oncology appointment next week.
That's for that referral.
Get that
That's a
referral.
good point. That's why I said earlier, we don't always get the information up front. And I'm huge on any woman that's going through breast cancer treatment should have automatically a referral to a lymphedema therapist, just to get a baseline assessment, and then they can monitor you every so often. So if you start to develop issues, you can get it addressed. And then you'll go from doctor to doctor, they'll say, well, my treatments didn't cause that, so I'm not, that's not in my area of specialty. But yes, it is. You're my care provider. You deserve to pay attention to what I'm telling you. So I say that, don't be afraid to speak up. If you have a medical provider who's not listening to you, find somebody else. It's okay. But if you see something, you're experiencing something, no matter how small you think it is, please bring it to the attention of your medical team so it can be addressed. Yes.
One thing I want to mention, you showed the comfort sleeve, which is a much softer and better one than the big puffy one at night. But that is available. And then now, last week, I get new sleeves, and they said that if it has a design, it's $10 for the goblet and 15 extra. So that here doesn't pay that. But I have a question, Dr. Pumper, because it's just after you use it, it's kind of serious. I have an arm, chest, and a little pump. So it seems to be serious. So I don't know if it's, after listening to the lady talk today, Dr. No, I was like, maybe it's dehydration. I don't know. But I have more stiffness, and I just don't like that feeling.
Yeah, and again, I would say, sometimes garments need to be adjusted on the pump to see if that will help improve some comfort, or if you're actively being seen around. So, for example, I'm at risk for lymphedema because I've had lymph nodes removed on my left side. So if my left arm were swollen, that fluid would need to be moved across to my healthier lymph nodes to drain out, and then it would need to be pulled down to my healthier lymph nodes down here in the groin area. So that's what that means, manual lymphatic drainage. Next, we have compression bandaging. So this is just a picture of someone. She's stage 3 lymphedema, as I showed earlier. And this is someone that I bandaged in short stretch bandages. And I like to point out, these are not ACE bandages. ACE bandages are completely different from the type of bandages needed for lymphedema treatment. These are specifically designed to not stretch for a certain amount, and so it's going to specifically help to prevent fluid reaccumulation in the arm and the hand and the fingers to help move that fluid out and for it to stay out. And also, if there's hardened, thickened tissue, that compression will help to break that down so it's easier for fluid to move. Exercise. So when I say exercise, I'm not talking about walking a 5K, running a 5K, but when you do very gentle exercises, if you're wearing compression, whether that's garments or compression bandages, that further helps